So the guidelines originally, which were based on the studies that were done looking at low-dose CT scan, were for people who were age 55 to 80, who had a 30-pack year tobacco history, and who were either current smokers or who had quit within the past 15 years. Now, a 30-year pack history, what that means is if you're a 1-pack-a-day smoker for 1 year, that counts as 1 pack year of exposure. If you're a 2-pack-a-day smoker for 1 year, that's 2 pack years. So those were the existing guidelines. Just recently, the U.S. Preventive Services Task Force reduced the age of eligibility from 55 down to 50, and also reduced the pack year eligibility down from 30 pack years to 20 pack years. So this expanded eligibility will allow people who previously wouldn't be able to get lung cancer screening to get this important test. So the importance of this change in the guidelines is that it now includes groups of people that are specifically at higher risk of lung cancer. So for example, these changes are particularly important for some communities of color. Lung cancer rates are much higher in African American and Black men than they are for white men. In addition, African American smokers and to some degree Latino smokers tend to smoke menthol flavored cigarettes at higher rates. The reason that's important is when people smoke menthol cigarettes, they're able to inhale more deeply due to the cooling effect of the menthol, and they can actually get more nicotine as well as more toxins per cigarette than people who don't smoke menthol cigarettes. The reason that's important in relation to lung cancer screening is that people who smoke menthol cigarettes tend to smoke fewer cigarettes per day, even though they're getting the same amount, if not more, toxin exposure. So for people who smoke menthol cigarettes, such as African American smokers, they may not have previously reached the eligibility criteria for that 30-pack year threshold. So by lowering it down to the 20-pack year threshold, it's very important for menthol smokers who predominantly are African American. So there's a growing amount of evidence showing that linking lung cancer screening to effective tobacco treatment is really important. So if you think about it, the people who are eligible for lung cancer screening are the exact same people who would benefit best from quitting smoking. We tend to see people in our tobacco dependence program who are in that older age group who've been smoking for long periods of time and who really both want to quit and really need to quit based on their health. So making that linkage, if you're going for a lung cancer screening test, to have information and services available to refer that person for tobacco treatment, and vice versa. In our tobacco treatment program, we often talk about the benefits of lung cancer screening and refer people back to that screening test. So having that link both ways between tobacco treatment and lung cancer screening is really important.